back twice in a row. Y'all can't even stand it. You've been coughing a long time? Watch this video to get my thoughts on how you can make that go away. And should you worry about it? Okay. So this is informed by more than 20 years as a family doctor, and also by now the last years having been a functional medicine doctor. And how do we get rid of coughs when they're really bugging us? And when is a cough concerning? So I had a friend who was recently at Walmart, and they were coughing, and in the parking lot, somebody asked them, "Hey, do you have COVID?" Because they were worried about did they had COVID. Well, and it bears to mind, how do we tell when a cough is concerning? Okay. Um, and in general, we're in the season where we are going to get coughs. And I think it's very reasonable to periodically, if you have a cough, that to check and see if you have COVID, because we might want to wear a mask to protect other people. But what if you have a cough that's been going on a while? How might you can see if you need to go to the doctor? First off, if you've had a cough that's lasted more than 6 weeks, conventional medicine definitely starts to go, what's going on there, right? Usually when you go to the doctor after a short cough, the doctor will say, "Oh, it's probably a virus," and then they will send you home with maybe some a little bit of symptomatic stuff. How might you get it to get better, though, and not just get the symptomatic stuff? I'm going to give you a couple of things that I suggest for my patients. Now, you need to really review this with your doctor, but in my family, we call it magic. It's magic, and if we start to get sick, we like pound this. Okay. The first one is X-Clear nasal spray. X-Clear nasal spray. That has some xylitol in it, and that's actually been shown that the component that xylitol to, and I'm not saying that this is a treatment for COVID, but we know xylitol has some effect in studies against that virus. But X-Clear is very helpful for lots of things. It's a mix of herbs. So I love X-Clear, and we start to squirt it up in our nose like every hour. Okay. The other thing that we start to squirt in the back of our throat is called Biocidin. Biocidin is the boom, it's the bomb, y'all. You can get a spray that you can spray in the back of your throat. It's not prescription, it's a supplement. Once again, it's an herbal mix of things that is antifungal, antiviral, and it can make, if something's just starting, it can make it go away, right? So my Aura Ring, for the last few nights, I've had a slight increase in my temperature, 0.5 degrees for 3 nights in a row. Last night is up 0.8. So today I am pounding these things. I mean, every hour. The other thing that you could use up the nose, get this area, right? Because any virus coming in comes here first and then can go down, right? Is Argentin 23. Argentin 23 is a micronized silver spray that is small enough particles that the silver is not a problem. And it is also antifungal, antiviral, antibacterial. And that's something else that you can use. Now, this Argentin 23, I wouldn't be using every hour. I'd be using that 3 times a day if I were getting sick. Okay. So this is, let's say you've had a bunch of congestion and cough going on a long time. Is it something to worry about? Usually, if you're having stuff up here and not just a cough, then it tells you it's likely a virus or allergies or something like that. The only case where I see that may not be true is if you have if you are breathing something in your house that's causing the issue, right? So we presume it's just allergies. Could it be like mold behind the wall? Something we want to think about, right? Especially if it persists a long, long time. So if you have an isolated cough that lasts for more than 6 weeks, that is a time that you do want to get it checked out, right? Because as a family doc, I would start to think, okay, what does this person have that's making this cough persist? First, we're looking to see, do you have a fever? Do you have elevated white blood cell count, which would suggest an infection? And then, so we wonder, could it be walk-in pneumonia? Sometimes people have an ongoing cough. and they have walk-in pneumonia. That means they've got an infiltrate in their lungs that's causing them to be coughing. Could it be something worse, something in your lungs that's causing a cough? And so if there's something in there, we want to find out if there is. So many times after 6 weeks or more, your doctor will do something like maybe order a chest x-ray, look and see if there's something there. Certainly, if you have a bloody cough, you must go get it checked out by somebody. Okay, so that's, and I don't mean just like something coming from your nose, like, mucus in your nose with a little bit of blood. That's not unusual, but coughing up from down low, blood always must be checked out by somebody, by whoever's caring for you. So let's say the other things we think about are tuberculosis. Do you know tuberculosis is still worldwide a pretty common thing? Tuberculosis can cause a long cough, and it can be difficult to get rid of. So the place people have more likely have exposure to tuberculosis are if you used to have a family member that had tuberculosis. You may not realize it, but tuberculosis can be like reactivated in the body, and you could have gotten it a long time ago. From a family member, or if you have been volunteering in a nursing home or in jail or someplace like that, more likely, or if you've been traveling, if you've traveled the world, it might be something that could be an issue. So we, after 6 weeks of cough, especially an isolated cough, we're going to, hopefully your doctor is going to do like a PPD skin test. Or a blood test if you've had the BCG vaccine, which is like in Mexico, they have the tuberculosis vaccine, so you can't do a skin test on those people. But there's other ways that you can check. So making sure it's not pneumonia, not cancer, not tuberculosis. Could it be reflux? Reflux can actually cause a persistent cough, right? Because it irritates the back of the throat. So there, interestingly, I just learned a way to help with reflux. And it's y'all know when you remember the Jane Fondas where you lay on your back and you make a bridge, you put your butt up in the air and you're so that you're making a bridge and you're squeezing your buns. Y'all remember that? Well, in that position, swallowing can help exercise your lower esophageal sphincter, and it can help with reflux. And there's a small study showing improvement in the lower esophageal sphincter tone, which helps keep the acid in the stomach where it should be. All right, so I know that. So we wonder, could it be reflux? Reflux is something else that, and your physician might give you, or your practitioner might give you a trial of something to see if it's reflux that's causing that cough. Other signs that it might be reflux is if you wake up in the morning and you've got like sort of an acidic taste back here in your mouth, you notice that it tastes sort of like acid, or you feel like, oh, I always got something in my throat when I am sleeping in the night. So the reason I say you might try some of those natural products, Biocidin, Xclear, Argentin 23, is because if you can make it go away with that, it's not something bad. Okay, right? And I think it's important for everybody to be able to manage things as much as possible, right? And so that's why you guys, if you're interested in getting a lot of random free advice that you need to check out with your doctor first, you can join the Energy for Life community of anti-agers and holistic people who believe in holistic ways of healing. And if you're interested in knowing more about how you can access some free functional medicine advice, you just got to send me an email, the links below, and I'll tell you all about it. All right, guys. Any thoughts, or did I cover that okay? Yep. Okay. Awesome. All right. I'm going to say bye to our streamers. Love you guys. Later.